All right. Well, thanks for taking a minute to learn a little bit about the Balance Center. My name is Jason. I'm a physical therapist, and I'm here to talk about the Maine Strong Balance Center. So, the Balance Center is a physical therapy clinic, and we're a group of physical therapists who specialize in balance. And to sort of tell a bit more about it, I thought I might go back to our origin story in terms of how we all sort of got started. So I was trained in the Boston area. I went to the Massachusetts General Hospital Institute of Health Professions, and I was living and working and training down in the Boston area. And what became clear to me sort of at that point in my career is that I really, really enjoyed working on balance. I just found it so interesting professionally. In other words, there's so many factors that go into it. I found it really engaging. And I just found it really rewarding. If you can do something meaningful for somebody so that they're feeling more steady on their feet, it's a really nice sort of fun thing to be a part of. The other thing I noticed sort of in that earlier part of my career is that the healthcare system doesn't always serve balance the way that I would hope that it would. There's really brilliant physical therapists, and there's really thoughtful, healthcare systems that are trying to do really great things, and they are. But one of the downfalls is that if you're going to work on balance, it really takes time. And in healthcare, traditionally, it's really hard to get one-on-one time with anybody, let alone enough one-on-one time to sort of address balance. So with these sort of pieces in place, knowing that how fun it is to work on balance and how rewarding it is, and seeing the healthcare system, which has brilliant, providers in it, maybe not doing as good of a job as it could, the idea for, building a center or a physical therapy clinic that just focuses on this was born. And I was really lucky enough to meet my wife in the Boston area, who happens to be from Maine. So now we make our home in Maine, and we founded the Balance Center here in Southern Maine. So the Balance Center currently is in Scarborough, but we do have quite a bit of programming in the South Portland area. So keep an eye on the community center and age-friendly South Portland to sort of see different events and classes that we'll be running in your area. And we're also interested in expanding our services specifically into South Portland. So we're just sort of a hop, skip, and a jump away in Scarborough. And we're sort of ready and willing to help you now if you need help with your balance. But stay tuned, because we should be in your town in the not too distant future. So the next piece that I sort of wanted to unpack a little bit is the Balance Center is sort of a new idea. And I think it takes some explanation in terms of what we do. So in some ways, we're doing the same things that an outpatient physical therapy clinic does. So what I mean by that is we're a group of physical therapists, and we do things like take insurance. So, if you've got Medicare or Anthem or an Advantage plan, these are all things that we use to sort of pay for our services. There's other ways that we're different. So these are sort of what sort of the foundational properties of what makes up the Balance Center and sort of what we're doing in the community. So the first thing that's kind of, first and foremost is time. So if you're going to make a change in your balance, or if you've got someone who's worried about falling, or maybe has fallen already, or anywhere in between the two, it takes time to sort of invest in your balance. So the evidence for changing balance is that many hours over many months is sort of what it takes. And you need somebody there to sort of help you. So in other words, if I'm going to ask someone to do moderate to high intensity balance exercises, I've got to be available. So at the Balance Center, what we do is we spend 40 plus minutes of one-on-one time each session with somebody, just hammering away on the balance. And again, this is an area where in healthcare generally, we haven't been able to sort of deliver. And then over time, what we find, and this is sort of, evidence-based, in other words, this is what the literature shows us, and then this is what the data is that we track at the Balance Center, we make big differences. So if you spend time with somebody, either showing them what to do and they do it on their own, or doing it one-on-one in the clinic, you can have profound impacts in someone's balance and fall risk. And as a result, you can sort of, be really transformational in their life, which is, again, fun to be a part of. So time is one thing that's sort of different, or what sort of is foundational to what we do at the Balance Center. The other pieces that I sort of wanted to talk a bit about is we do spend quite a bit of time on the assessment. So when someone comes through our doors, we spend usually about an hour with them, again, one-on-one. And we're taking a history. We're just trying to really listen to what are the different factors that play into this individual's sort of fall risk or balance concerns. So as some examples, if someone has a vision issue, or if someone has pain in a certain area, or if someone's on a number of medications, or if they've got a blood pressure issue, these are all things that can negatively contribute to someone's balance. And even though they seem like different body systems, they're really related, and they're statistically related, meaning they're powerful predictors of who's going to be off balance. So a big part of what we do is we're really listening and trying to get the full picture as to what's going on with somebody. The next piece that kind of really makes us, a balance center is that we spend a heck of a lot of time on the education component. So during a session, we'll spend a lot of time doing fun balance exercises. We've got harness suspension systems, or we're walking through obstacle courses, or doing all these really creative, fun balance exercises. But usually, or typically, the other half of the time is spent on education. And by education, I mean quite a few different things. So sometimes we're on the phone with the primary care physician talking about blood pressure medications, or other times we're on the phone talking to the optometrist about, what we can do from a vision standpoint. Other times we're, spending time on trying out walkers or canes or walking sticks, and we go outside and around the building and just try to figure out what's the right device for somebody. Sometimes we're just sitting down and talking about home safety. There's simple sort of tips around the home. And if someone's having trouble, for example, in a low lit area, that might be a low hanging fruit sort of consultation about how to change that home environment. And we're also spending time on things like how to fall more safely, or how to get up off the floor if you needed to. So again, we're doing really sort of fun, high-level balance exercises one-on-one with sort of an expert physical therapist. And we're spending a lot of time on the education piece to sort of treat the whole person so that we're cutting down on your risk. The other piece that I really wanted to sort of share is that we're really good at collecting data. So we've got sort of a core set of tests that we put everybody through. And I liken it to like when you see your primary care physician and you get your blood work done, and they're checking your cholesterol levels and your blood sugar levels. At the Balance Center, we've got a standardized core set of tests where we're testing your strength, your balance, your endurance. What does your walking look like? And what we can do is we can put that data into our software, and then over time we can track it. So after a month of physical therapy, or after a month of exercise on your own, we can take you through the tests again and see how we're doing. If we're doing better, great. We sort of keep going down that path. And if for some reason we're not doing better, okay, that's an inflection point where we want to change what we're doing. The other way that we're using this data is we recognize that balance is not a short-term issue. It's not something that's rehabbed and then just sort of goes away. Balance is something that's foundational to somebody's health over time. So another program that we've got set up is if you would like to, after sort of receiving services, check in the future, oftentimes we'll recommend coming back for sort of a balance physical at 6 months or a year down the road. The idea being that we can take your data points again, compare them to how you were previously, and make informed health decisions. Again, similar to the blood work, if the physician notices a change in your cholesterol, that might be a change in medication. If the physical therapist at the Balance Center notices a change in your balance scores or a change in your walking or strength, we might recommend a different set of exercises. So that brings me sort of to the exercise prescription. At the Balance Center, this is what we do all day long. So all of the staff is taking continuing education. Some of us are clinical specialists, meaning we have advanced training in this area. We're comfortable tackling the vestibular system, which is something that is sort of a specialty. So my point is we've got a group of really smart therapists who are highly trained, do this all day long, and they're ready and willing to help. And they're excellent at curating or crafting a home exercise program or helping with the balance. And then the final piece I wanted to communicate is that, we recognize that balance is something that takes collaboration. At some point, outpatient physical therapy can't do it all. And we're really excited to partner with the community to do, interesting, innovative things to help. So as I mentioned in the beginning, keep an eye on the South Portland programming at the community center, or which is the age-friendly group. And you'll see us around now and in the future, sort of offering different community classes or educational lectures, with the idea being that balance is a long-term project that needs investment over time, and nobody can go it alone. So I appreciate you taking some time to listen to me and hear a bit about the Balance Center. If you have questions or you're not sort of sure how to proceed, you can check out our website, which is www.mainstrongbalancecenter.com, or you can call us. Our phone number is 207-303-0612. And if you've got questions about anything, how do I start physical therapy? What do I need? Can you, come to South Portland to meet this need that the community is noticing? We're here, we're available, and it would be absolutely our pleasure to help. And I know sometimes healthcare is confusing in terms of, do I need a referral or what does my insurance cover? And to keep it simple, just contact us and we'd be really happy to sort of walk you through and do some of the legwork for you if you need any help. So just in sum, if you're somebody who has questions about your balance, you qualify for a balance assessment. You could be more than welcome to come into the Balance Center and we could sort of let you know about your risk. If you're someone who's got some questions about balance and wants to learn more about the community sort of programming, you can absolutely come into the Balance Center, have a battery of tests, and then we can communicate with you to connect you to the right community classes. And if you're somebody who really, feels they need one-on-one care, again, this is what we do all day long, and it would be absolutely our pleasure to help you. So thanks again for spending the time with me. If you've got any questions, reach out to the Balance Center, and in good health. Hopefully we'll talk soon.